Hi, I'm Josh McDonald.
Hi, and I'm Miranda Materi, and we are Hand Therapy Academy. Almost forgot who I was.
It changes all the time.
Yeah.
Let's talk about postoperative edema. They're just off a surgery. Maybe they come to you a couple weeks out from a distal radius fracture or flexor tendon injury, and they've got that edema. What's your go-to? Like, what do you start with? Miranda, what do you think?
Well, I just remember from my CHT exam, the most important thing they can do is elevate their arm, right? So, usually the first thing I'm talking to them about is like making sure they're doing exercises where they're reaching over their head and getting their arm moving to help with the edema. And then when they rest it, that they're resting it in a slightly elevated position, not in a dependent position. So, that's number one. And I always do that. And I think it's based on just, yeah, reading what the research says.
Yeah, that's been hammered into our brains so many times. It's elevation, and then second on the list is compression. Yeah,
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 so we're always elevating first, and I tell them that, it's always in my
yeah.
spiel, and
Yeah. I like to educate patients on what elevation actually means. And so they think that walking with their hand in front of their face is elevation. And that doesn't count because then fluid pools and backs up at that elbow bundle of lymph nodes. So I tell them if I put a drop of water on your fingertip, it should roll downstream to your shoulder the whole way. So it doesn't have to be dramatic elevation. You have to walk around with your hand up over your head like you have to go to the bathroom. But when you're sitting on the couch, put that arm on the armrest with maybe a pillow and just a slight downgrade from fingertip all the way to shoulder. That's going to help that fluid drain out with gravity.
yeah, that's a good I like the water, that's a good one, the drop of water, it's a good
Yeah.
tip. You can really visualize it.
And I like to like to educate them that they don't have to live life like that. Like when you're sleeping, if your arm is just on a pillow next to you, that's still draining downstream. If you're going to walk to the fridge, it's okay to have your arm down so they don't develop that like CRPS arm guarding position. Like let your arm hang down if you're walking to the car or walking to the refrigerator. But then when you're going to be stationary in bed, at the couch, at the kitchen table, then put it in a position of elevation just to let that fluid drain out. But the 3 seconds it takes you to walk, you don't have to hold your arm in the air. That's unnecessary.
Yeah, definitely. Another thing I like to tell these patients to do is some deep breathing. Get their parasympathetic. So, like, I want you to just take some deep breaths in. Make sure even if they have to feel, their diaphragm and feel the air coming in and out, that can be huge. And then educating on why that's so big for edema management.
Yeah, yeah. That deep breathing thing is something I think we overlook that says it's not just going to manage edema, but it can help with their anxiety about the injury. It can help with stress about the situation and getting back into life again. That just taking them through that, it feels like I'm here for my hand. Why are we working on breathing? Like, trust me, everything's going to go better if we can just get your system regulated.
Yeah, and it's just like, oh, I just need you to take a couple of deep breaths. And who doesn't need that? That feels so good for everyone.
Yeah, yeah. Set your phone down, take a couple deep breaths. It'll all be okay.
My favorite is when my watch tells me to take a deep breath. I'm like, you're
Yeah.
right. Just take a couple of deep breaths.
Shut up, watch. You don't know me.
You don't know me. I don't need deep breaths.
Okay, so some of the things we want to do that help manage edema the best may not be allowed within their precautions. So, intrinsic activity is a great way to get some of the edema pumping out of the hand. Digit abduction and adduction can be a great way to use those intrinsic muscles, the interossei, to pump fluid out of the hand. But that may not be allowed if they're on a flexor tendon protocol or collateral ligament fractures or whatever. But that's another good way to get that fluid pumping if they're allowed to do that.
Yeah, that's a great one. What about, are you doing any retrograde? Or
Yes.
I know now it's called something else.
Yeah, I try to document carefully what I'm doing. I'll document it as edema reuptake but I'm not trained in, and I am completely like unskilled in lymphedema massage. And so I try to be careful to not make my documentation or my treatment look like I'm doing that because I'm clearly not skilled in that. I should be probably more skilled in that. But I'm not doing the full like start proximal, work to distal. That's a very long process. So yes, we do a lot of edema reuptake stuff just to get the lymphatic vessels communicating fluid proximally. But I don't know lymphedema stuff, so I stay away from some of that.
Yeah, and just so our audience knows, lymphedema, it's a special certification that you can go through, and it's kind of its own beast. So
Yeah, yeah. And can be highly effective with our distal radius fracture population, with some of the patients we have, if that fluid is getting caught up, maybe the system is not functioning well. But I'm not skilled in that, so I'm dealing more with the acute localized area.
right. And then lymphedema and edema are different things. So
Yes, yes, yeah, very different things. And so the edema they have from an acute injury can very much be managed with just mobilizing the fluid. You know, you've got pitting edema on the back of the hand. I just spend some time breaking that fluid up, making it um, uh, more viscous and getting it moving a little better. Sorry, less viscous. I always get that wrong. Making it less viscous, getting it flowing and moving, and just trying to get some activity in that hand. And then I'll roll into apple picking and maybe the foam roller rolling it up the wall, just trying to get some overhead reach to tension and stretch all those lymphatic vessels, get him moving.
yep. Okay. So we said elevation, range of motion, and then compression. What are you doing for compression?
If I can, my easiest and most simple solution is an edema glove. If I can get away with that, that I feel like gives a good uniform pressure. It's something they can do easily at home, and it's simple to understand for the patient. If I can get away with that, great. If they've got a flexor tendon, I can't put it on. If they're ginormously swollen or incredibly painful, can't move their thumb to get that thumb in that thumb hole, then I can't do that. But that's kind of my starting point.
Yeah, and I feel like those are inexpensive, and
Yeah.
usually something that insurance doesn't cover, but they're like 6, $7. So
Yeah. For us, for at our clinic, that's one of those things that we give out the first one. If they need a replacement, we show them where to find them on Amazon, and they can buy one from us for like $11. But I just consider that cost of doing business because it's such a cheap thing to give them. It wears out in 2 weeks if they're active with their hand, but they can find them on Amazon super easy.
yeah, I think that's hard to justify when their insurance is maybe paying us $45 a visit, and we're paying our therapist 50 an hour. Like, I don't know. Sometimes I'm like, I don't even know how we justify this, but
Yeah.
here we are
Yeah.
giving you some free stuff.
I know. And I do that more often than I should. Maybe that's a whole different topic about what things I give away and why. And I'm trying to be better about not giving away too much. But I feel like some people are in that crisis mode, and I don't want to say like, here, you need to go buy this, buy this, buy this, buy this. I want to say like, here's just a solution.
Yeah.
Here's a solution.
Yeah.
Yeah.
And I agree with you. You don't want to like nickel and dime our patients. And when they're there, it feels good to be able to give them stuff. But I don't know, as reimbursement gets cut, it's like harder and harder to think like, how do we maintain, even just a profit margin, even not even like a huge one. You just want to, how do we pay our therapists and keep everyone happy?
Yeah. 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 That's tough. All right. That's a
Tough.
whole different topic. Let's stick to edema. Okay. So if you're not doing an edema glove, what are some of your other ways to do compression?
Tuba grip. I love tuba grip. I think that's awesome. You can double it up. I think the key with tuba grip is not making it too tight, right? If it's too tight, they're going to have throbbing. They're going to have a lot of pain. So, and most people don't know there's measurements for edema gloves and there's measurements for tuba grip. So you don't just have to like try it on and say, oh, does it feel good? Do the measurement and see if it's the
Yeah.
appropriate size, because that's based on how much pressure. Because there is such a thing as too much pressure, and that causes more pain and more swelling. So making sure you have the right amount of pressure is key. If the gloves, so tuba grip, I really like, and tuba grip's funny because I was telling a therapist, go grab the tuba grip, and they were grabbing the tubing for the handles you put on, like the built-up handles. So I think making sure you have a universal language for the stuff you're using is
Yes. Yes.
is good.
Yep. Yep.
Um,
I prefer we call it because it's what the box. It's just the box says TG Grip. So I prefer the TG Grip 2 that is less dense and compressive than
oh,
the TG Grip normal, the standard. I feel like the standard, even when I do the measurements, everybody talks about it so tight. It's hard to stretch onto the patient. And I know the TG Grip 2 was made to be doubled up on itself. I find I get way better outcomes if I give a patient a TG Grip 2, let's say level C, and I just do a single layer of it and I don't double it up and I cut a little thumb hole and I let it come out to like MCPs with maybe a little fold over. I feel like I get good results out of less is more on the amount of compression. I feel like the TG grip is just so dense that I prefer the two.
yeah, that's interesting. I think you bring up an interesting point. There's a lot of different types of compression, and what TG or all the other ones, like making sure you are buying the same one in the brand because they all differ.
Yeah, yeah. And it doesn't matter what any other clinic is using as long as you have a standardization to what you're using, even between your clinics, if you have multiple, just so you are all speaking the same language and finding like, here's a universal way that we find success with. We say it all the time. There's lots of good answers to the same question.
Yeah. What about, are you doing any like chip bags,
I,
things like
I,
that?
yeah, I
Tape?
love the chip bag. I find it super effective, but I find the number of people for whom I can use it is pretty limited. Because if it's a distal radius fracture, they have to have the wrist support on. Well, do I make it a rounded chip bag? And then so I feel like there's a group of patients for whom it works great, but then there's a bunch of things where I can't use it because logistically it doesn't fit within their protocol. But I
Yeah.
love it. It's a fantastic option.
Yeah, I really like the chip bag too, and it's basically just different densities of foam that you put in a stockinette or you put in some type of uh, encompassing thing that holds all the foam pieces together, and it works really well. I think it works really well for people that have like major trauma and major swelling.
Yeah. Yeah.
Oh,
And I try to find some way to make that work, especially if it's like this big polytrauma and they've got to be in some wrist thumb support
yeah,
spica monster thing. I try to find some way to get just that constant. The idea is as they move just a little bit, the little foam indentations cause the light edema reuptake kind of massage all the time. So it's great if you can make it fit within their protocol.
yeah, that's very true. I feel like when you and I were working at that, were the trauma hand surgeons, we did a lot of those, and now I feel like I don't do nearly as many.
Yeah,
So,
yeah,
what
yeah.
about are you doing any kinesio taping for?
Um, no, not really. I just don't see a ton of those, what I'll call more chronic edema patients. I feel like that's something, and I don't think it's only for chronic. That's just kind of where I've categorized for myself for my treatment planning. Um, I'm not a huge fan of kinesio tape on the hand. I feel like we're so active with our hands that if a patient is active, it sloughs off and rolls off and sweats off so readily. I feel like most patients that I put kinesio tape on their hand, they come back the next visit like it was off within an hour or two or a day. It didn't stay on. But if a patient is super swollen and they're not using their hand, that may be a better option for it, where it's going to stay on because they're not bumping into stuff and it's not going to roll off as easily.
Yeah, I think those are all great options. I think with edema, we want to get rid of it. One thing we didn't say, we want to get rid of it as soon as possible because we know it can lead to a lot of other problems if you don't get rid of it. So I think early on as a new grad, I didn't really think of edema as being that big of a deal, but I think it's a pretty big deal and we should manage it early.
Yeah, yeah. Lots of good options to manage it. Kinesio tape is definitely a good option. Maybe not in your wheelhouse. Co-banding, we didn't talk about that one, but tons of good options for managing edema. But like Miranda said, get it under control as quickly as possible so it's not clouding movement and limiting range of motion and limiting function. Yeah, yeah. Well, if you have other favorite things you do, we couldn't cover all of them here, but if you have some other favorites, definitely comment below. You can also reach out to us on social media at Hand Therapy Academy or our email info@handtherapyacademy.com.